Intersectionality theory and its connection to health. If someone were to ask you to describe yourself, how would you? Would you bring up your age, race, or occupation? Would you bring up your likes and dislikes? Maybe you would bring up your favorite movie or a random fact about yourself. Humans are complex, and no trait-specific box could explain that complexity. So why take that approach when it comes to healthcare? Research has shown us that things like gender, ethnicity, and social class have had a strong impact on our health. Of course, these things don't exist in a vacuum, and no one person can be described using just one of these descriptions. Instead, we have multiple characteristics that together integrate and shape our lives. So what is intersectionality? There is so much complexity that comes with these added factors. For example, imagine a population on the grid. There are differences in race, sex, social class, sexuality, etc. And here we begin to question how these subgroups differ on different levels of health and disease, and how do we explain these differences? This is where the intersectionality theory comes in. Now, what exactly is intersectionality? This theory was created by Kimberly Crenshaw, who originally coined the term to describe the discrimination experienced by Black women. She gave the example of a lawsuit against General Motors for not hiring Black women. The company hired women and Black people, but did not hire Black women specifically. Crenshaw showed how sexism and racism can combine to create a distinct type of disadvantage, and later this model was extended to other areas. Together, these different types of discrimination result in varying forms of advantages and disadvantages, which can lead to differences in health. Intersectionality can be important to see how interlocking forms of discrimination can lead to new inequalities. For example, me and my two best friends, Liza and Sierra, are all women of color but face different experiences with accessibility to healthcare. Liza has talked about the difficulties she faces surrounding healthcare, during which it is impacted by the place that she lives. She lives in a small town called Barlow, where it is hard to find places to get access to healthcare due to living in a small town, and drives at least 30 minutes to find places to access healthcare. In comparison, Sierra talks about how navigating situations with her mom can be different and difficult because her mom doesn't visually match her, and how this often leads to misunderstandings or misguided assumptions about their relationships, especially explaining the physical resemblance doesn't define their bond or the medical history between her and her mom. With me, I have often had dietary suggestions that do not fit with what my diet regularly consists of, and I've also had a few instances where it was assumed that I did not know English because I was talking to my parents in Hindi prior. Now, what does the research say? There have been several studies that have explored gendered racism, a simultaneous experience of racism and sexism among Black women. These findings revealed how these intersecting forms of discrimination influence coping mechanisms and ultimately mental and physical health as well. Though intersectionality isn't confined to one group, it is a framework that helps extend our understanding of health discrepancies across diverse populations. For example, HIV prevention strategies to dissecting the effects of systematic racism and sexism. Intersectionality sheds lights on the complexities of health outcomes. For example, redlining. Redlining is a discriminatory housing practice of denying financial services or resources to certain neighborhoods based on their racial or ethnic composition. For example, the areas designated as hazardous for lending were often subjected to environmental hazards and lacked green space or access to healthy food options, contributing to adverse health outcomes. These neighborhoods frequently hosted industrial sites and pollution sources, exposing residents, often minority populations, to environmental hazards, which limited access to healthcare and worsened asthma outcomes, leading to higher severity in these redline areas. The biopsychosocial model often comes to mind while thinking about an intersectional approach to healthcare. One way healthcare has been adopting a more intersectional approach is through the biopsychosocial model, where there is an integration of biological, psychological, and social factors to understand how various intersecting identities such as race, gender, and socioeconomic class impact health outcomes. This approach recognizes the interconnectedness of these factors and their collective influence on an individual's health and well-being. As we navigate the complexities of public health, the integration of intersectionality theory offers a promising path towards achieving health equity for all. By acknowledging and embracing our diverse identities, we move closer to a future where everyone has equal access to health and well-being.